Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to the PMB Pulse Show. I'm your medical presenter, Shubnum Ismail, and we are live at the Ansar station at 240 Ottoman Road, PMB, jamming out on 90.4 in Turban and 105.6 FM in PMB. Get ready for a dose of medical magic straight to your ears. Let's get this pulse pumping and make your morning a whole lot more interesting. As we reflect on World Stroke Day, which took place on the 29th of October, we're excited to bring to you a special episode that's all about stroke awareness and care. Joining us are two leading experts in the field who will share their knowledge and experiences and insights to help us better understand this complex condition. So let's get started. First, we have Dr. Zaheer Sacoor, a renowned rhenologist with a passion for stroke care, and Renathe van der Merwe, coordinator for Fast Stroke South Africa and Namibia. Renathe has been instrumental in spreading stroke awareness and education across the region. Some of the topics we'll be covering include the fast approach, the importance of timely intervention, and the role of community support in stroke recovery. And I'm really looking forward to our guest speakers this morning. Dr. Sacoor, a renowned neurologist with over a decade of experience in stroke management, is a true leader in his field. He's traveled the world presenting at prestigious academic meetings, including the NASA yearly congresses and the World Congress of Neurology. As a director of a sleep institute, Dr. Sacoor also brings a unique perspective to the complexities of neurological care. He is also intricately involved in specialist clinics utilizing Botox administration for various neurological conditions and vertigo management. A pioneer in his field, Dr. Sacoor has worked tirelessly in both public and private sectors and is currently specializing in private practice and also the founding director and visionary of Royal Rehabilitation Hospital. Dr. Sacoor's passion for helping others and creating meaningful human connections is truly inspiring. As he says, I have strived and continue to strive to step on my limits like they are never ending staircase. We're honored to have him share his expertise with us today. Dr. Sacoor, Assalamu alaikum and welcome to the Pulse Show.
Assalamu alaikum, Shubnum, and assalamu alaikum to all your guests. I didn't expect that introduction, but thank you very much for that. Yeah.
And welcome, Renathe. It's great of you to cross over all the way from Sasolburg in the Free State.
Good morning, everybody. Thank you so much for the opportunity to join you today.
I hope your insights on stroke care and management is going to be valuable to our listeners, and we're eager to learn from both of you this morning. We're going to dive straight in with Dr. Sacoor. So, Dr. Sacoor, can you tell the listeners what is stroke and what are the main types of stroke?
A stroke is basically a sudden change or damage to the brain. The key is sudden. Basically, something happens, and in an individual that is normal, he suddenly, let's use an example, he starts to droop in the face, or his hand starts to become weak, or he has a change in his speech patterns. So, but it's not limited to that. Though we'd use this acronym called FAST, which is a global type of sort of, how can I say, a trigger, where if you have a facial droop or you have a loss of arm strength and you get a sort of a drift of the arm, and or you have a change in speech, it can be any change. So a guy comes and he's normal and suddenly he can't see, he must be concerned about a stroke. If he suddenly can't walk straight and he's losing balance, he must be concerned about a stroke. So that's the sort of crux to it. You need to remember that. And then the last part of the FAST acronym is time. And I think that's the latest and the most important part. We will obviously chat a bit more later about that in terms of the interventions. But there's many types of strokes, but there's two that are the ones that we have to be immediately aware of. One is a clot, and there's a whole host of management options now that have become available with a clot. And then the second one is a bleed. And one needs to urgently differentiate the sort of between the both, because the management pathways are different. And that is the crux of modern medicine, is differentiate a bleed from a clot and intervene effectively in either. So basically, I don't want to sort of delve on that. I know you've got lots of questions to go through, but that's basically the sort of bottom line of that.
So, Doc, can you enlighten our listeners about the risk factors and how can they be managed?
Yeah, that's a very, very important question, and so basically, you get two types of concerns, or sort of, you get what we call a young stroke, and those patients generally don't have the usual risk factors, and then you get the elderly. That's changing now, because it's a physiological age as opposed to just a number. But essentially, in a patient that has what we call vascular risk factors, essentially your blood vessels carry your blood to the brain. So if anything creates wearing of the blood vessel, it creates narrowing and what we call arthromatous plaques. Eventually, it can lead to a tear and a clot. A common one is hypertension, diabetes, hyperlipidemia, obesity, sedentary lifestyles, and those so any hyperlipidemia, high cholesterol, a patient presenting with previous blood vessel problems, like he's got a cardiac problem or a peripheral vascular disease issue. So the fundamental point is two sets of individuals, like a 23-year-old who's pregnant that suddenly gets a stroke due to what we call venous thrombosis. That's a set of patients that we overly we will investigate, and be concerned about those patients, because they're young, and this is the prime of their life. And those patients need intensive workups, and they're usually admitted for a while. And then you get the elderly. Obviously, as I mentioned, there's a guy can be 70 and his age is 50, in terms of his actual chronology. And but you think about blood vessels and whatever damages or ages the blood vessel.
Doc, in terms of the warning signs, what should our listeners look out for?
Yeah, I think again, very important is there's two issues or categories. Well, there's probably more, but two. I don't want to complicate things too much. It's simple. A change in your neurological state when you awake, and then you get the wake up stroke, which is a little bit different, because obviously you were asleep, so there's not a change. You'll wake up with something different. So, a guy, as I mentioned, we use the acronym FAST: facial droop, arm sway, change in the speech. You get a sudden slurring of speech, and then there's the last one is time. But there's various forms of that has come through of these acronyms. But but it's simple. The guy is normal. He's talking to you, and suddenly he can't see. And he's got vascular risk factors, like he's your mom or dad, and he's hypertensive. Get him to a place that is stroke ready. And we'll chat about that a bit more later on. And I just like to sort of come in here and say we're very lucky with the Angels Initiative through the last few years. They've driven everything effectively. And I think most hospitals in big cities are stroke ready. So if you need to get to a hospital in Maritzburg, I think we're very lucky. All of our big hospitals are stroke ready. And it just depends. I work in the city, and all of them are stroke ready, and even Hilton. So Yeah, so I think I'll stop there on that question, and then but a change in a neurological condition. Yeah.
I fully agree with you, Doctor, that in Pietermaritzburg, we're very lucky to have foundations of great hospitals with the Center of Excellence also for stroke management. In terms of, obviously, stroke affects the brain and there is long-term effects. Can you actually inform our listeners some of the treatment plans to rehabilitate a stroke patient and highlight some of the strategies used to actually get them to get back to life?
Yeah. So again, very important. So there's stages of stroke management. There's stage 1, stage 2, stage 3, stage 4. Now the big thing at the moment is the acute stroke management, and I think we're getting pretty good at that. And Guy comes in, and I'm sure we'll chat about the latest managements a bit later. He has this effective management early on. However, for various reasons, he still has a residual deficit. Then he moves from stage 1, which is the casualty, to stage 2, which is a stroke unit. Now, a stroke unit has made a tremendous difference, where generally only stroke patients are admitted there. They have specialized treatment. If they've been thrombolized, that's the latest form of treatment. They have a set a protocol, because if this guy has been given very strong, or girl has been given, or lady has been given a very strong blood thinners, you can't do any procedures on him or her that will result in bleeding. So we have these protocols. So that's the stage 2, it's a stroke unit, stroke high care, and you manage the patients there, and then subsequently you want early rehab. And it makes a tremendous difference in patients that have had a stroke on their pathway to recovery. Now, rehab is not only physical rehab, because you got a 65-year-old that just retired, that's got all these plans to travel and live his life, because he's been working all his life, and suddenly he's barely able to walk. So it's both physical rehab, psychological rehab, social rehab, and I mean, disability claims need to be processed. People need to live. So one has to be very clear that these pathways need to be followed, and it makes a tremendous difference if you follow the pathways and the protocols. And we sort of most of our patients previously will have a stroke, emergency care, then they go to the ward, then they go home, and then you got this in a scenario where, yes, when you got family that have adequate resources, that's good. Then you have a scenario where you have a Mr. who was the sole breadwinner, and he's 60 years old, and he comes home and his wife is working, and he's barely able to get out of the bed, and then his youngest daughter, who's in matric, needs to be pulled out of school to look after him. Otherwise, who's going to look after Mr. So I think one has to be cognizant of this, and understand that there's facilities available at all levels. And so you have to be aware that it's just not only initially managing the patient, is understanding this patient's pathway and supporting all and sundry on that difficult journey. And the other issue is caregiver burden and caregiver strain and respite care, because I mean, it's not easy to manage someone that was the sort of the stone, or the core of the family. Now he suddenly, or she, becomes the biggest somebody that requires care. So I think as healthcare workers, as professionals, we need to be aware of this journey, and educating people is vitally important. Yeah.
Absolutely, doctor. And listeners, as you've heard, stroke is really complex, and there's so many strategies to rehabilitate and get that patient back on their feet. In terms of the golden hour, I believe that medical intervention in stroke treatment is so important. Doctor, can you tell us why is it so important to get the patient to a medical facility within that time?
I think this is probably one of the most important messages today, and I was just sort of waiting to go for this one. Now, what we have understood is that before, without the help of modern medicine, there was a lot of, how can I say, there was no drive in treating patients with stroke because there was not much we could do. We could give the patient a Disprin and say, shame, that guy's had a stroke, and let's treat the patient that we can help. Because we were very, very disheartened almost, but we knew that we couldn't. Now with modern medicine, with these fancy electronic devices and scans and equipment and medicine, there's a huge change in that. And I think that this field is changing so rapidly that it's, you got to be on this on the books every week, and you're going to be going for these seminars regularly to know what's available. Now, if a patient is showing a change in neurology, now, as I mentioned, the two parts, the one is the wake up stroke, which guy comes, he goes to sleep at 10 o'clock at night, and he wakes up in the morning and hey, bang, he's got a stroke. And we don't know exactly what time that started. It could have happened early in the night. It could happen just an hour before he got up. And that's a wake up stroke, and there's lots of newer management options there. Then there's the patient that he's had breakfast, just went to his room, and he comes back and his wife finds him, he can't speak and he's drooping. Now, this guy, he's got a vessel blocked. We're just sort of assuming that, or obviously there's many, it's complex, but you got to assume that it comes down to simple plumbing, let's call it. Now, what we've realized, and this is the crux, is though the neurology or the fallout is large, he may have a right hemiplegia, the damage is not complete. So what that means is the blood has been blocked. This patient has a dense right-sided paralysis and he can't speak. But if you unblock that vessel in this golden hour, and there's timelines, we'll talk about that just now, you can actually reverse the stroke, except maybe a small core. And if you leave this guy alone and don't do that, then after maybe 12 hours or so, 6 hours, but this timeline is changing due to various modern medicine, medical interventions. But fundamentally, you have 4.5 hours. Preferably, the sooner the better. 1.8 million cells a minute is being lost. So you take your dad, your mom, straight to a stroke-ready hospital, whether you take them in Maritzburg to Middles Medical Center, Hilton, St. Anne's, Mediclinic, they're all stroke-ready. So you take them there and you say, I think my dad or mom is having a stroke. So immediately they activate what we call a stroke pathway. So the patient actually doesn't even see the casualty officer. He's seen by the nurse quickly, checks his blood pressure, sugar, he's not diabetic, and he's having a hypoglycemic episode, assesses the patient within a few minutes, and the patient goes straight to CT scan. There's no waiting for authorization. There's no waiting for paperwork. He goes straight to CT scan, and then on his way to CT scan, the doctor is assessing him. He's having other tests done, maybe some blood tests, etc. And when he goes to CT, we want to know whether it's a bleed or clot. And if it's a clot, that's one pathway. If a bleed, it's a second pathway. So we want the guy to have the treatment ideally in the first 60 minutes, even faster if possible. And if he has the treatment in the first 4.5 hours, it's still effective, but it's not as effective as if you do it quicker, because obviously it's still viable tissue. There's something called collaterals and penumbras, and I'm not going to go through all of that because of time constraints. And I know we need to sort of move on. But the patient shows signs of a stroke, straight to casualty. Obviously, Durban, all other parts of the country may be different, and you need to find out about this, especially if you have someone with vascular risk factors, so you know what to do in a hurry. And so you get in, they do the scan, and then they give this life-saving, not life-saving, but a huge, valuable drug called thrombolysis. And there's some modernization of the thrombolytics that we can use. And previously there was one, and now there's probably two, and maybe there'll be more in the future. And then the second thing we're doing is thrombectomies, where as the cardiologists go and suck out the clot, we have the ability now, because of these different fantastic devices called the Penumbra and Mercy, etc., etc. They go in with the right hand, and you suck out the cloth, and it's shocking. I mean, a guy comes in. I've had so many patients. I had a patient 2 days ago. Came in, couldn't speak, had a right hemiparesis, and we gave her the cloth busting drug because she came in on time. And the next day she told me she wants to go home. She's fine. She said, no, we got to do these tests and all. No, I'm fine, doc. I need to go home. But normally a stroke is buggered. I mean, it's she's having a shower in the morning, and that's great. It's something that but you got to get it on time. That's the crux. And as I mentioned, unfortunately, you're not going to get good news all the time. Most patients are coming in late, unfortunately, especially from the rural areas, and they're coming in the next day. And this is where the angels are working the hardest. They've helped us a lot in the big cities. Now they're working in the smaller cities, the rural areas, and I think they're doing a wonderful job. I really respect the effort there, and I think they've been the change, if you ask me. But what you call so sorry, I'm going on a bit because it's such an important point. I think I probably need to stop soon.
We can hear how passionate you are about your discipline, doctor. And I fully agree with you. Timely intervention is key in order of getting that patient to the door to start treatment. One of our listeners has actually sent a question, and I wonder if you're able to answer, is what advice you will give to someone who had a stroke and is worried about having another stroke?
Yeah, that's also such an important question. So I take you back to the risk factors. And like uncontrolled hypertension, uncontrolled diabetes, uncontrolled hyperlipidemia, sedentary lifestyle. So fundamentally, the issue is the guy's had a stroke and he's gone through the pathway. One, acute management. If he's lucky, the drugs worked and he's normal. If he's unlucky, he's got some sort of deficit. Deficits depending on various things. I mean, a stupid example of a deficit. If a guy is a pianist and he's got impaired dexterity in his right hand, he can't play the piano anymore. That's a major deficit. I mean, for a guy that's maybe teaching, he's got slight issues in his right hand. It's not an issue. But so deficit is relative to the individual. And this is how we decide on treating patients as well. So the guy who's a pianist, he can't move his hand properly. It's a major deficit. So anyway, coming back to the second part, then the third part, and the rehab, which we think is a crux to follow the pathway. People say after 2 weeks in hospital, I want to go home, and the family feels bad because they say, hey, what, my mom and dad wants to go home. But if they don't have the pathway, I think they actually, and what happens is, in that pathway, you identify all risk factors. So often the guy, you didn't know he was diabetic. He didn't know his cholesterol was 8. You didn't know he's got chronic renal failure. So you identify in terms of risk factors. You must control the hypertension. You must control the diabetes. You must stop the smoking. You must stop the alcohol. And this is where a good medical team has to manage that and then hand over to his GP to monitor the pathway of control. And I think that's the sort of his biggest, and then obviously the lifestyle. I mean, I think the most important thing in my practice is telling people, get off the couch. They talk about the what they call it, the social media rotting nowadays. Guys just sit on the phone and sit on their bed, and they don't get out of their houses. They spend an hour, 2, 3, 4 hours of valuable time. So 4 times a week minimum, I want my patients walking for 40 minutes. Trying to eat correctly. Try to have your supper early and close the tap or the shop after that. Common sense things, because if you do the common sense things, it's more effective than most medicines that I can give you, and I promise you it has no side effects.
Absolutely. There's so much to unpack when it comes to stroke care and stroke management, and we're going to tackle that in our shows in the next few months.
Maybe, yeah.
But Dr. Sacoor, absolutely. Dr. Sacoor, thank you so much for joining us today and for sharing your vast experience on stroke care. Your insights has been truly enlightening, and we've covered some critical topics. Your dedication to pushing boundaries and helping others is a testament to your remarkable character. So, we appreciate the time you've taken to educate and inspire our listeners this morning. Alhamdulillah. And we're
You too.
grateful for your contribution to the medical community.
No, no.
And as you've said, that you have strived to step on limits and they are never ending staircase. Your passion is evident and contagious, and we're honored to have you as part of the conversation. Is there any final closing remarks to the listeners before we actually move over to Renata?
Yeah, no, again, thanks, Shabnam. I've listened to your show a few times, and you're doing a wonderful job, and thanks for inciting and helping the public. And then, sorry, Renata, I mean, I stepped into your time quite a bit there. Apologize for that. And yeah, I think we started a little bit late, so it was great. But again, and if there's any questions in the future, I'm happy to maybe answer them, and we can come back again and do another run at strokes or any other topics. Yeah.
Thank
Thank
you.
you.
Thank you again, Dr. Sacoor, for being an exceptional guest on our show, The Pulse Show. We wish you continued success in your mission to make a difference in the lives of others. So, we're going to take a short break. Don't go anywhere. We'll be right back with more insightful conversations about stroke management, explore ways to provide better care for those in need. Stay tuned, and we'll be back in a flash. Assalamu alaikum wa rahmatullahi wa barakatuh. And if you just tuned in, you're on the Peter Marisburg Pulse Show. I'm your medical presenter, Shubnum Ismail. And today we are tackling a very vital topic, which has really been great since the start with Dr. Sacoor, a trendsetter neurologist in the city. And we're going to move over to our next discussion with Renathe van der Merwe. She is the coordinator for Fast Heroes South Africa and Namibia. And with a strong background in biological sciences and a postgraduate certificate from Northwest West University, Renathe has dedicated her career to improving stroke care. As a former Angels Initiative stroke consultant, she's worked tirelessly to enhance acute stroke pathways in pre hospital and hospital settings. Her expertise and passion led her to become the national coordinator for Fast Heroes, a renowned stroke awareness program. So, Fast Heroes is an award winning initiative that educates pre primary and primary school kids about stroke recognition and responses. Renata obviously focuses on the rolling out of these programs, and we're going to discuss this in a bit. So, Renata, welcome back to the show, and it's great to have you all the way connecting with our listeners from Sasolburg in the Free State.
Thank you so much, Shubnam. Thank you very much to your listeners as well for the opportunity to join today.
So we're going to pick up and dive straight in from what Dr. Sacoor had actually mentioned in terms of timely intervention, education. Can you enlighten the listeners about your program under the umbrella of Fast Heroes?
So, Fast Heroes, Dr. Sacoor made mention to the Angels Initiative. So, that's the team that works in the hospitals with the specialists and the EMS. But then they realized it doesn't help the hospitals being stroke ready and ready to treat the patient, but the community is not aware. So, the big need for stroke awareness was there. But we needed a program to facilitate and make it fun and make it enjoyable for everybody involved. So that's where Fast Heroes started, and we all grew up with the 10111 and other emergency numbers. But I mean, these days the children are not taught the emergency numbers anymore. So this program was developed by the University of Macedonia with the support of the Angels team, and we are lucky in South Africa to have the Heart and Stroke Foundation as our major partner. So they've created, Dr. Sacoor made mention to that FAST acronym of knowing how to recognize the signs and symptoms of a stroke. So they took that FAST acronym and they've created this whole animated world. So we've got characters like Frank, Armando, and Sophia, who are retired superheroes, and then Timmy and Tanya, who are the small heroes that really know what to do in that emergency. So Frank, Armando, and Sophia are the superheroes that gets the stroke, but then they are really saved by Timmy and Tanya that knows what's happening and also know that 112 is the emergency number to dial. I just want to make mention that this program is aimed at the foundation phase learners, but there are many schools that incorporate this into the intermediate phase. So that's the grade 4s to grade 7s, and there is no cost involved to any school that wants to join this program. And I think for South Africans, there's not a lot that we can say that are for free in terms of resources for schools. So yeah, I just wanted to say that's the gist of the program. Yes,
And I'm sure the listeners, if they want to reach you, we can share your details a bit later to have some educational programs
absolutely.
at their schools. And I also have some content at my offices as well for the local schools in Peter Marisburg, because we just concluded a stroke campaign. So there's lots of content, brochures, leaflets that you can actually get from us with some guidelines. In terms of education, let's go back to that. Why is it vitally important that we continue with such?
With stroke, as Dr. Sakur said, time is so important. So the sooner that the patient gets to the appropriate hospital, the better the chance the patient have of a better outcome. But the reason that we focus on the young learners with this is because our communities are structured this way these days that children spend time with their grandparents, with the neighbor next door, with a lady at aftercare, because most of the younger parents are busy. So that's why we focus on the young children, because it might be that they are the ones that need to recognize and know what to do in that emergency. With Fast Heroes, we also engage with parent participation. So there is a component where we would love the parents to register on the site and also learn about what the children are doing in the classrooms. And that way the children can gain some points, and some schools use that point system as a little bit of a competition. But the reason that we need to continue with education is because there's just too many people that think that they've got time when they are having a stroke, or when a loved one is having a stroke. And we want them to realize that it is an emergency. You need to seek immediate medical attention straight away.
And how does one recognize the symptoms of having a stroke? I mean, I cannot emphasize this question enough. It is so vitally important.
So that's that Be Fast, or that FAST acronym that Dr. Sacoor has said, is that your you look at the balance of, did the patient lose balance, or are they feeling dizzy? You look at the eyes, or do they have any loss of vision? So that's the B and the E. And then fast is obviously hurrying up and being quick, but the fast is also, you will look at the patient's face. You can literally ask them to smile, because if they're having a stroke, often the one side of the face will smile, but the other side will just be drooping. The arm, because a stroke patient can't straighten their arms and keep it like that, the one arm will either droop down or it will be completely paralyzed. The S is because of the slurred speech. So often a stroke patient will speak like this with a slurred speech, or they can speak but it's not making any sense. The sentences are not forming correctly. And then in severe cases, the patients can't speak at all. And then the T for time is hurry up. This is an emergency. So, just to bring it to that characters that I've mentioned, I will also share this image on your platform. But we've got these different characters. So we've got our Frank, Armando, Sophia, and Timmy and Tanya. So Frank is the superhero that had the ability of pulling funny faces, but now one side of his face is drooping. And Armando was very strong and he did weightlifting, but now his one arm is weak. And Sophia, she had the superpower of telling stories and singing songs, but now her two lips, her speech is impaired. But Timmy Time, he used to be late for everything, but now he knows that he has to hurry up. But what's very important is that it's not just the signs and symptoms that we teach the children, but what the emergency number is. And that is also directly linked to those signs that we look out for. So the emergency number is 112, and it's also one side of Frank's face that's drooping, one arm of Armando that goes weak, and two lips of Sophia that is not speaking anymore. So it's 112. And that's sort of the basis of what Fast Heroes is about.
Hmm. And can you tell us what are some common myths about stroke?
I think, like we said, is that people think that they have time. In general, people often see things like heart attacks on TV, so they almost immediately associate it with an emergency. You have to hurry up. But with strokes, people have got this misconception that they've got time. They think, oh, it was an old person, it was bound to happen anyway. They also think there's not much that people or that can be done for stroke patients. In some cultures, unfortunately, they believe it's a curse from ancestors. But if people often ask, the most important thing is that urgent attention, because strokes are treatable, but it is an emergency. And again, like Dr. Sacoor alluded to, get to your nearest stroke treating hospital. So don't go to the clinic. Don't go to your general practitioner's rooms, although those healthcare professionals are wonderful in what they do. In this particular instance of a stroke, you have to get to the hospital for them to be able to do the scan, either CT or MRI scan, to determine what the course of treatment should be for that patient.
Hmm. I totally add to Dr. Sakoor's sentiments in regards to the work you guys do in terms of Fast Heroes and the Angels Foundation and hand-holding the acute hospitals in order of education and programs, which is so much needed throughout the province and around the world. In terms of the survivors, what continuation of programs does your foundation offer?
So with Fast Heroes, we don't necessarily work directly with the patients, but on a very frequent basis, we partner and collaborate with the Stroke Survivors Foundation. And this is really a wonderful foundation that I would urge any family member of a stroke survivor or the patient themselves to get in touch with, because the Stroke Survivors Foundation, they offer the post discharge. So after you have left the hospital, that support. And I mean, who better to offer support than somebody that truly understands what you are going through? Because that recovery journey that that patient and the family is on, they do definitely need support, and that is where the
Mm.
Stroke Survivors Foundation come in. I'm sure that we can post their web address on your platform, but for those that are listening, it's www.strokesurvivors.org.za, and they also offer support groups, and I know that there's even an online support group for people that are not able to physically go to a hospital where they offer these groups.
Mm. I know that the Angels Foundation offer workshops and courses online for um, obviously the clinical staff, the medical staff to go and have some courses and accreditation. In terms of your Fast Heroes, what programs and offers do you have for healthcare professionals?
So for the healthcare professionals, we are lucky because of our history with Angels, we can partner with the ambulance services. We can partner with the hospitals as well. So say for example, there's somebody that is affiliated with a primary or pre-primary school or class that is listening today. What we often do then, with the help of the EMS and the hospitals, when the school says this is okay, we want to continue with this program, then we register them on our website. So after they've given their go ahead with the registration, then we know how many learners, how many children in the class or school will participate with Fast Heroes. And then we will schedule a session with the teachers, because I can't assume that that teacher has got the background knowledge about stroke. So with the hospital, with the EMS, we then go and give that training to the teachers. It can either be online, or sometimes we do like a hybrid type of event. And then we explain stroke, but we also explain how Fast Heroes work. And then the teachers then continue with this Fast Heroes program in their classrooms at a time that is convenient to them. Because we know that teachers are very pressed for time. They've got their rosters, they've got certain things that need to be done, certain assessments that need to be done. So in between times, then we provide them with material, workbooks, posters, access to our online platform that they can utilize to teach this valuable life skill to the learners. I also just want to mention that the Heart and Stroke Foundation is also a partner, and they, for the listeners, got great information about healthy living, about the Heart Mark products that you can find in store. So I would urge you to go and have a look at their website as well.
Mm. And what are your final parting words to the listeners, and how can they get in touch with your organization?
So for me, it is really, again, thank you so much for this opportunity to be able to share this. If there's any teacher, school, or class that is interested in rolling out this program aimed at the foundation phase, they can either visit us at fastheroes.com. I am willing to give my number. My number is 082 523 5487. So you can send me a WhatsApp and say which school you are from and that you are interested. But please also follow us on Instagram, Facebook, and we've just launched on TikTok as well.
Thank you, Renata, for joining us on this special Pulse Show, an edition of Stroke. And as we come to the end of today's episode, I'd like to take a moment to summarize some of the key points we've discussed today. And we've talked about the importance of recognizing the warning signs of stroke. So, obviously, the fast approach, and which is the face, the arm, the speech, and time. We've also heard from our guest about the latest treatments and therapies available, and the critical role that you, the community, and our listeners plays in stroke recovery. I'd like to thank our guest, Dr. Zaheer Sacoor, and Renathe, of course, from Fast Heroes, for sharing their expertise and insights with us today. Your contribution has made invaluable in helping us achieve our goals with treating the complexities of stroke care. To our listeners, I urge you to take care, learn the science, share the knowledge, and be part of creating a community that is equipped to respond to strokes. As we close, I'd like to leave you with the final thought. Every minute counts when it comes to stroke care, and by working together, we can make a meaningful difference and save lives. I'd like to thank our technicians, both Durban and Pietermaritzburg, and to you, our listeners, for tuning in today's episode. Until next time, stay healthy, stay informed, and stay connected. Assalamu alaikum wa rahmatullahi wa barakatuhu.